Dr. Paul here. We get to see a newborn.
A newborn with much going on.
Well, there's little things going on that you're going to learn about.
Big things.
Well, everything's big when it's your newborn.
Yeah, true that.
Hello. Did you have some questions? I think you had a picture you wanted to show me, maybe.
Oh, yes.
Yeah. So
we found a little red tinge of something in his diaper, which we thought might be from the umbilical cord, but we were not completely sure.
Well, this young man has a clip right there, so we're gonna take that clip off. And my guess is, see how the diaper is near the umbilical cord? Mm-hmm. So this is probably blood from the umbilical cord, almost certainly. There is this thing called brick red where the when you first start urinating, so you've been in the womb and you're fed through the cord, and then when you first start to make urine, your kidneys are opening up for the very first time, and they'll release crystals that look almost like blood, almost. It's just like a slightly brick red, not red, but what's the color of brick? It's just not quite red.
Mm-hmm. Right, yeah.
It looks like that, and we call it brick red, and it's just crystals, it's not blood, but a lot of people get confused, and it's usually on the diaper right where the pee is, right where the urine is, that's where you'll see it. So, we've got a slightly open soft spot up here. Now it's interesting, soft spots can be huge, like a huge diamond up here, or they can be really tiny, like a fingertip there. It's all a range of normal. So don't worry if you've got a nice, soft, squishy anterior fontanelle. We're gonna look at the mouth. Quick break for a word from our sponsor, Let's Get Checked. If you've experienced fatigue, lack of energy, you're having sleep problems, you're having anxiety, depression, mood disorders, you can get your answers from the comfort of your home without needing to see a doctor by using Let's Get Checked. So there will be a link in the description below of a various number of panels that I recommend. Things like essential vitamin and nutrient panels, things like hormone panels for males and females. There's even a kit for Lyme disease. You should take advantage of as many of these as you can. This is the way that integrative medicine works. And not only that, Let's Get Checked will have a doctor review your labs, have a nurse call you, and in some cases, the doctor will even make prescriptions for you. So it's an amazing program. I'm using it myself in my own home. I've got family members using this program. You get a 20% discount by accessing using my code, DrPaul20, DrPaul20. Check the links in the description and go ahead and get yourself tested in the areas that you feel you might have the most need. So one of the issues we had with feeding was difficult latch. And so I like to see how the tongue looks. That looks about average, honestly. You'll see that tongue, when you look under the tongue, there's a point at which the tongue is attached. And if that attachment is right at the tip, the tongue would not be able to extend to the lips or past the lips. I think this tongue would. Oh, it's okay, honey. It's okay. You like to suck, don't you? Yeah. There you go. So
when he was first born too, he was sticking his tongue out pretty far.
Yeah. So his degree of tongue tie, I think all kids are tongue tied today. His is minimal, or shall we say moderate? Okay. Yeah. Hey. So babies that don't console unless they're sucking, once breastfeeding latch issues are resolved, you can try a pacifier just so that daddy's got a way of consoling this guy. Or you can do this with your finger, but yeah. So he does have a smallish mouth, and that obviously makes it tricky for you. Because I mean, that's a little mouth. Now I'm trying to work my finger deeper into his throat, and he's not resisting, but he is sort of. There we go. So now this is so much easier to do with a finger than the breast, right? Right. Because I can kind of slide it deeper and deeper.
What's the point?
So the point is, if I can get a deeper latch like this, it's going to be less painful and more effective. And he's still, some babies gag by now. He's not. My finger is now in the back of the throat, and he's still going for it.
Oh, gosh.
And so this would be a very effective latch. Now he's sort of resisting right there, so I'll stop. See if he'll accept it. Can you do it? He's like, I'm not sure about this. I'll cut you some slack. So anyway, you can see I had gotten up to here.
Wow.
Right? And when, look at the blueness of my finger.
Yeah.
That's your poor nipple, right? Because he's got a really strong suck. There he goes.
Yeah.
So there he's back on it. I'm gonna
He
turn
came out of the womb
just
smacking and sucking as soon as he
he
came
was ready.
out.
Like, where is it? Where is it? This may be a kid who'll just be happier with a pacifier.
Okay, that was also something
I
that
think,
they didn't.
yeah, you don't want them early.
Right,
It will mess up your latch.
Okay,
But once
okay.
once latching is like a piece of cake for you,
Okay.
you can try it, and as long as it doesn't mess up your latching, then you're good.
Okay.
All right, we're sounding awesome. You gotta sort of multitask here, I think. But you see how that hand is up near his mouth? I think he'd be a thumb sucker.
Yeah,
You know what I
he's
mean?
always trying to-
So that whole thing about pacifiers, for people who hate pacifiers, just realize here's a kid who, if you don't end up using a pacifier, they're going to be a thumb sucker, and it's really hard to get rid of the thumb. We can get rid of the pacifier later.
Pretty old, yeah.
So, yeah, but yeah, good suck.
Good.
Now, kiddo, I'm gonna have to I need my finger back. So maybe, Daddy, you can take over.
Yeah, I'll wash my hands.
Yeah, wash your hands. I'll let you take over. Otherwise, he's gonna be unhappy. There you go.
Just do your visit through the camera screen, Dad.
Through the cameras? Oh, yeah, there we go. Okay. That's the modern day, right? Virtual visit. Babies like this have never seen infections, right? You're in a sterile world, and you're protected from all viruses and bacteria. You get the antibodies from your mom's body through the umbilical cord, and then she's continuing to provide immunity through breastfeeding, which is awesome, by the way. Why it's one of the reasons it's so much better than formula. I do believe cow's milk is for calves. Yes. So human milk. But back to my point. Why is it that babies never get sick, almost never get sick the first 6 months, even up to 12 months? They never get strep, they never get lots of infections. They have natural, what's called innate immunity. It's inborn, it's there, and that is why they can handle new infections so well. Coronavirus, a novel virus, new infection. Human race had never seen this strain before. Kids do fine. They have robust innate immunity. Old people lose that innate immunity, especially very old people, which would explain, at least in part, why COVID has been so devastating to the very old and virtually a nothing for children, especially younger children, school-age children. We need to exercise our immune system by exposure to new viruses, which is what every virus is new for this little baby, right? Think about that. COVID is just another new virus. Yep, no need to be afraid. We have wonderful immune systems. We're wonderfully made. Go figure. All right, back to my visit. Gonna check pulses down here. So, the femoral pulse tells me that the blood is pumping beautifully from the heart around the aortic arch all the way down to the toes. Obviously, I know that because the feet are pink. But if you have a coarct or aorta, which is the reason we check femoral pulses, I wouldn't be able to feel that pulse. And coarct aortas can cause problems. Then I'm going to check for testicles. So, folks, there's a testicle here, and the other one, it's down, but it's a little off to the side. It's no big deal. It will move into the scrotum. I can feel it right there. And this one I feel right there. So, pediatrician's job with regards to the genital exam is to make sure you feel both testicles, and as long as they're not in the abdomen, then you're good. So that's just an interesting little by the way. Checking the hips, we grab the hips. I've got this finger on the trochanter here and my hands, and I'm trying to dislocate them by pulling and pushing, and then splitting like a chicken wing, like a chicken, to see if they dislocate right at that hip, and they don't. So we've got stable hips. We don't have to worry about hip dysplasia. If missed, what can happen with that is if you look at if you imagine this as the pelvis and this is the femur, which is your leg bone, it sits in there nice and tight. if it's dislocating, then this hip socket will get loose and you'll have problems with the rest of your life. That's why we check for dislocation. His hips are perfect. Now, I'm gonna look at the back while you finish. There we go. We don't have a deep sacral dimple. That's normal.
Why do we check for that?
Oh, if you have a deep sacral dimple, you might have a tethered cord where there's stuff around the cord kind of pulling. And then this is very normal baby rash, so not to worry, whatever. A little bit of hair, they call it lanugo, that's normal baby hair. No problem there. Oftentimes, almost all babies have a little birthmark back here. Boy, it's pretty minimal, if any.
They mentioned something about a stork bite in between his eyebrows, maybe.
And then that one of my kids has a very prominent one. I don't really see much
I know, I
either.
don't really
There's
see
something
it.
a little bit on his right eye, I think, but
Oh, maybe a tiny, tiny little possible birthmark there. So pretty clean there. Now I'm gonna go ahead and take off this cord clamp. It's this is real high-tech stuff here. So they even sent you home with a cord clamp remover, which is so nice. So this just goes in this little hole right here, like so. And then I pinch it and it goes clip. And then we can separate this and come off there. There we go. So the cord here can get real goopy
A little
and
further back, please. Perfect.
it's totally fine. So there's nothing to do. This is going to come off. I'm going to go rewash my hands because I've been touching the cord and people are going, oh my God. I laugh in the face of danger. New parenthood is so exciting, and I think you have to be young to do it. I was once there. I did this 4 different times, and then I adopted a bunch of other kids. But you have to, it's exhausting. Hang in there. You guys are doing amazing.
thank you.
Your next checkup's at 2 weeks. Dr. Paul, you guys, thanks for watching. And a big thumbs up for amazing couple and an amazing baby.
Aw, thank you.
Bye, little dude.